Welcome to Ideas in Action, a television series about ideas and their consequences. I'm Jim Glassman. This week, obesity in America. It's no secret that Americans are fatter than ever. It's an issue getting a lot of attention in Washington these days. But what role should government play in trying to help people slim down? Joining me to discuss this topic are Dr. Scott Kahan, co-director of George Washington University's Weight Management Program and faculty member of the Johns Hopkins School of Public Health. Justin Wilson, he's a senior research analyst at the Center for Consumer Freedom, where he focuses on food and consumer issues. And Penny Lee, executive director, the Campaign to End Obesity, a group that advocates for federal policies to reverse the growth in obesity and to promote healthy lifestyles. The topic this week, responding to America's obesity crisis. This is Ideas in Action.
Funding for Ideas in Action is provided by Investors Business Daily. Every stock market cycle is led by America's never-ending stream of innovative new companies and inventions. Investors Business Daily helps investors find these new leaders as they emerge. More information is available at investors.com.
60 million Americans, including more than a third of all adults, are now considered obese. Obesity has been linked to type 2 diabetes, high blood pressure, heart disease, stroke, and depression. The costs of annual medical care for an obese person is 42% higher than for someone who is not obese, driving up the cost of health insurance. But how should we beat obesity? Should it be classified as a disease, and should the government mandate that insurance companies cover the cost of weight loss programs? Should consumers pay a tax on food and drink that the government believes contribute to their growing waistlines? In short, what is the role of government in confronting the obesity epidemic? Penny, why is it that the obesity epidemic seems to be growing?
Well, we have had for many years now, unfortunately, an energy imbalance. We have continued to take more energy in and not expelling enough energy out. A lot of it has to do to our environments. Some of it is our own habits. We have seen progressively year after year a more sedentary lifestyle. We have seen an American culture that, we love, having grown up or having spent some time in Texas, we love the supersize. We love having as much as we can eat, to do as much as we can, the bigger the better. But unfortunately, as we all know, we can't have everything and we can't have it all the time. So we can't continue just to take intake without expelling some of that energy. So for the most part, in the simplistic way, our energy is out of balance right now.
So by energy, you mean calories?
Calories in, we're taking too much in and we're not expelling enough out right now.
Justin, how concerned are you about this? Do you think that obesity is a personal lifestyle, or is it something that the government ought to be concerned about?
Well, there's two different takes about what is causing obesity. One side believes it's a toxic food environment, to quote one of the primary researchers on this notion that we can't seem to survive in this environment of food. And the other side says that it's changes in the way that we're responding to the environment, the sort of lack of personal responsibility given the changes around this. I think it's an interesting way of thinking about obesity as sort of a result of civilization. We have gone from being hunters and gatherers or, middle-aged serfs to being what we are now, as sitting behind a computer desk and just typing away in a relatively short period of time. And it's kind of the point where I think we are not responding to our environment and we're not really taking personal responsibility for ourselves, because really and truly, that is the only reason why we're putting on weight.
But it's costing all of us when somebody else is obese. So shouldn't it be something that the government should worry about?
Well, I think you've made a fantastic argument against any kind of single-payer health care program. But I also think that you've opened the door to a question that most Americans are not really interested in answering, which is, should anything be allowed to be regulated if it's, has a so-called cost on our neighbor? I mean, the sort of policies that fit under that rubric of policy making are really troubling. We can start with obesity, but we can move to padded sidewalks and speed limits of 5 miles an hour. And, obviously this is a little bit absurd, but it's a slippery slope that I think has got legitimacy.
Now, Scott, you think that obesity or fighting obesity ought to be a top national priority.
Should be one of them, certainly.
And why is that?
Well, obesity is the major epidemic of the 21st century so far.
Is obesity an epidemic, or are the diseases that are the result of obesity the epidemic?
Both. Certainly, obesity causes a number of chronic diseases that ultimately can cause premature death, disability, and so forth. But obesity itself, I believe, is a disease and it should be classified as such.
So let me ask the same question I asked Penny. Why is it that people are much fatter? I mean, she says it's because we take in too many calories and we don't exercise, but why do we take in more calories and why don't we exercise?
And that's exactly the point. So there's many drivers of why we eat, why we exercise or move, of all of our behaviors. And many of our behaviors are being strongly driven by the environment that we live in.
So is there a legislative fix for this?
Well, I mean, there are many different things that we can do to improve. We can, it used to be that, back in my father's day or grandfather's day, for that matter, people walked to school every day, or there was a safe environment in which they could. Now you don't have that anymore. You load up on buses, you load up on, your parents take you in. So there's transportation environments that, yes, legislative we can do. We can make safe routes to school. We can make, things easier and safer ways in which people can engage, or kids can engage in playgrounds.
But you
and
wouldn't
schools.
say that kids shouldn't take a bus to school,
No,
or
no,
that
no,
the government should say no more buses.
No, that's not what I'm saying. I'm just saying they should have an alternative, though. If there are ways in which, you can move safely. Right now, there's some places you can't. So legislatively, there's transportation things that we can do. There's things as far as nutritional standards that we can increase. We can make it easier so parents know what actually is in the products that are in their foods. We can make labeling on our food products more accessible, more easier to read, more better to understand, so they can educate them. Right now, back in the 1950s, one hamburger was around 1.5 ounces. We now celebrate the 12-ounce burger, or the 15-ounce burger for that matter. People don't understand.
1.5, that's a tenth of a pound, a 10th pounder?
In the 1950s, your average hamburger was 1.5 ounces.
So
There's different things. So we need to educate, and that's what legislative we can do. There are certain things, again, in transportation, in the nutritional field, in the healthcare field, that we can educate people and make it better for them.
But it's hard for me to believe, may I ask Justin this question, it's hard to believe that people don't know that eating pizza or eating ice cream or eating, drinking lots of soft drinks makes them fatter. They don't think it makes them thinner.
I don't think that there's a lack of education on what it takes to lose weight. I think there's a lack of will. I think there's a lot of people who are putting on weight and they say, you know what, the trade-offs are not worth it. I'm willing to make this decision. And I think, it doesn't take a PhD in nutrition to understand what it means to be on a diet and how to keep the weight off. And everyone recognizes it's eating fewer calories and getting more exercise. But what frustrates me about the discussions that are going on in the government is that we're losing track of this notion that people should be able to make the decision for themselves. People are advancing this argument, well, we're all paying the cost of obesity, so we should all be able to regulate each other into a thinner nation. All the policies that have been proposed or implemented so far have failed. And it's not me saying that, that's Kelly Brownell from Yale University. And it becomes frustrating that the response instead is, we need, not to rethink it and readdress personal responsibility, but we just want more government intrusion into what I think is the private health sphere. This notion of, what two consenting adults eat in their kitchen is their business is being lost as we walk down the road of more and more government intervention.
Is it true that lots of people, including physicians, don't understand the basics of nutrition?
Yeah, and why should they? They're not taught it. Physicians aren't taught about nutrition in medical school. I mean, I literally did not get even 1 hour of nutrition training during my 4 years in medical school. It's hard to believe. On top of that, as much as it seems likely that most people out there, most lay people out there learn about nutrition, know about nutrition, it has not been my experience. I have many patients that come into my office. They're doctors, they're lawyers, they're accountants, they're very well-educated people. They have tons of willpower in every area of their lives. They come in and they don't know the basics of nutrition.
So what don't they know? Would you give us a fact that people would really be surprised to learn about nutrition?
Well, I had a patient that came in not too long ago. He's a lawyer, very smart guy. He comes in very much dejected about where he is in terms of his weight. And before he left my office after the initial interview, he said, "So what should I eat tonight for dinner? Usually I have pizza. Is that healthy? Should I eat that? I don't know. Should I have a salad?" So some of these things, they seem inevitable, but we don't learn this stuff. Do we ever teach this stuff in school?
Justin?
First of all, yes. There's every state in the country requires health education, and pretty much every standard health education does require that. Now, I think that when it comes to talking about obesity, we need to talk about health classes. We need to talk physical education classes. We need to talk about, believe it or not, home ec classes. Why don't Americans learn to start cooking again? And at the same time, the idea that someone doesn't know the difference, I always say a banana and a banana split is sort of beyond me. And at that point, I recognize that while they say they want to lose weight, if they're saying, well, I just don't know, it's an excuse, which is also why it's so troubling that we're trying to redefine obesity as a disease. It becomes so easy for people to then just say, I'm sick, I need help, and I can't do this on my own, to become dejected. Because in the end...
But they do need help. I mean, if someone is suffering and struggling with obesity, they need help and they need preventive and treatment for it. You can't just say, oh, sorry, you're on your own. I mean, that hasn't worked. So things do need to be addressed, and prevention and treatment do need to take place.
Let me ask Scott about that. Do you provide counseling to people, both psychological and informational?
We provide nutrition information, we provide psychological counseling, we provide group counseling, we provide medical treatment. We try to provide as much as possible comprehensively to help people manage that. At the same time, it's expensive. I mean, we have a number of doctors and PhD psychologists and dietitians on staff, and it's an incredibly expensive intervention that very few people can afford. We have, 100 million people out there that are obese and overweight, actually much more, and the tiniest fraction of that, far less than 1%, can afford an intensive intervention like what we give.
Well, let's talk about legislative interventions. What do you favor? I mean, would it be a good idea to have a big tax on soft drinks, for example, or on pizza or on ice cream?
I am not for the taxation of, what they would call sugar-sweetened beverages. I mean, we still don't know exactly if the companies were just going to diversify their cost and spread it down to the consumers, whether or not it has a regenerative or a impact on lower incomes. You also have cases where you have chocolate milk, strawberry milk that actually has higher sugar contents than actually a can of Coca-Cola. So there's still, I think, some more research that needs to be done on
what can be done?
What can be done? I mean, first of all, I think that we need to have BMI as a vital sign.
BMI
is your
body mass index.
Body mass index, to be able, so people know. I mean, right now, you know what a bad cholesterol level is. You know what your heartbeat should be. We should make BMI a vital.
Do you know your BMI?
I do, actually. I'm not going to say it here on air, but yes, I do know what it is. And there's standards, and so people are aware if they're getting close to a number that they should maybe, adjust their lifestyle. They either exercise more or eat less, so that we know, we can see it, especially with kids. This is where it's really important to make sure that they know kind of where they stand, so that they can begin some corrective treatments early, so it doesn't progress into some of the later diseases that we've seen.
What about menus? Should there be a requirement that all menus have the caloric content or the fat content of dishes?
I think it's an interesting question, but
that's why I asked it.
No, of course, because it's unclear if it actually accomplishes anything. People say they want information, and I'm the personal responsibility guy here, and I think people should be able to make informed choices. But in terms of its actual ability to reduce obesity, so far the results have been mixed, and those that seem to have had some, in fact, it's been relatively minor. I think to a certain extent, there needs to be flexibility because there's operational difficulties for restaurants. I've been to some restaurants in New York where, it looks like an Excel spreadsheet trying to figure out between the calorie counts and the price. And in Philadelphia, they want to have calories and salt. They want to have trans fats and grams of fat, saturated fat.
Actually, that's just on the menu, not on the menu board. So it's
just
easy
in Philadelphia.
And you're in favor of that?
I am very much, for a number of reasons. First of all, we talk about personal responsibility, but we have to help people be responsible. If they don't know about how many calories are in things, if they never learned about nutrition in school, they're not going to be able to make personal decisions. So I think having them on menu boards or on menus is certainly effective. I would also say that there's been a number of studies in this, and the studies are very, very, very positive. positive. There's been one or two that haven't been all that positive, but that's the way it is with studying
You're right. If you look at all of the studies in totality, there has been, 2 or 3 that have said that it's had small changes, and 2 or 3 that have said it has not had changes.
There have been 7 or 8 that have showed small changes.
I'm talking about the ones looking at New York.
1 or 2 that hasn't been.
So,
New York and elsewhere.
Aren't the people who are looking at these calorie numbers people of, let's say, high socioeconomic status and education who really aren't the major problem as far as obesity is concerned?
Obesity doesn't discriminate, okay?
But it doesn't. It certainly skews to lower socioeconomic status.
Yes, they're slightly higher, but it's across the population. And not everybody is going to look at the calories on the menu boards, and not everybody is going to make decisions based on that. But many people will. Many of them are in high socioeconomic groups. Many of them are in low socioeconomic groups. But it's information.
But it's only information at chain restaurants. You know, one of the complications is that the number of even in the federal bill, it's only at places that have 20 locations or more. In New York City, we're talking about less than about 5% of the restaurants that are actually displaying this. And when you talk about it for, racial and ethnic disparities, a lot of the smaller ethnic places don't have any kind of information whatsoever. And so, we should calibrate our expectations with policies like this, because all we've seen so far is a small reduction in the number of calories, but we have no idea. But
so what do you propose, Justin, if anything? Do you think obesity is just simply a lifestyle choice? I mean, there are organizations that talk about how fat is beautiful and stop bugging us about being fat.
I think it's a personal choice. Absolutely, it's a personal choice. And for those people who I guess, because choice is a little bit complicated, right? Some people say they want to lose weight, but that they're not willing to make the trade-offs. Because every single person, there's a spectrum. Someone who's maximally healthy. I actually personally fit into that category. I was at the gymnasium this morning. And then those who are maximize the taste in food, right? And we all fit on this spectrum. Some people say, I would rather have cheeseburgers and be 50 pounds overweight for the rest of my life. My dad is one of those people. The trouble is the government should not be trying to skew this, because I think it's a free market. And we should all have our ability to figure out where we fit in that place.
What's wrong with disclosing the amount of the calories things? It's interesting to hear, Justin, you want all about it being personal responsibility. But don't you think, I mean, to ask you a question, most of the children get their food right now, while they're in school. Shouldn't the government have the responsibility to make sure that those foods served in their schools have the highest nutritional
Absolutely.
ability?
You have to satisfy cost, right? Schools have limited budgets.
Right.
You have to satisfy taste. Kids have to want to eat it, and you have to satisfy health. And unfortunately, it's very difficult to get all 3 at once.
Right, and so I applaud the efforts right now by the president in trying to increase and upgrade the nutritional standards that we have right now. I mean, the bills that are moving through Congress right now actually would increase the nutritional standards. So those are some positive things. Again, you were asking legislatively what we could do. That's another example of something that could be done.
I wonder if Scott agrees with the idea put forward by a lot of people that we ought to have taxes on the kinds of foods that cause people to get fat, just as taxes seem to work pretty well with cigarettes in deterring people.
We live in a society in which the most unhealthy and most high-calorie foods are also the cheapest foods. They're also the most heavily marketed, they're also the largest portioned, and they're also the most available. And that creates the conditions for obesity to take hold. If you were going to create a society from scratch with the express intent of creating weight gain and obesity, this would be it. And so one of those factors is price, and price is an important determinant of people's decision making, whether it's around food or other things. So small increases in price in unhealthy foods combined with decreases in price on healthy foods like fruits and vegetables and lean meats would go a long way, and the studies show that it would go a long way toward making people or toward helping people make the right decisions around food.
What about bariatric surgery, where essentially your stomach is almost completely removed? That seems to work.
There's different types of bariatric surgeries, and different ones work differently. We only have a few years worth of data on it, and over the course of a few years, for certain people, it does tend to work. We still need longer term data. That said, once it comes around to bariatric surgery, or for the most part, once it comes around to weight loss programs like what I do, the horse is already out of the barn. We need to create the conditions for health long before obesity takes hold, because it's much, much harder to lose weight than it is to prevent.
But are you opposed to bariatric surgery?
I think that it's an appropriate treatment for appropriate people. I think that it's being overhyped in the media. I think that it needs to be, if it's going to be done, it needs to be combined with a really aggressive education campaign before and after the surgery. It can't be like other surgeries. Other surgeries, you go in, you cut the person open, you fix something, and then you let them go, and that's it. And that's what a lot of surgeons are doing with this surgery, and it's totally inappropriate because ultimately they still have to make healthy decisions around food. They still have to make healthy decisions around physical activity. And if they don't learn about that, if they don't get to the underlying roots of why they weren't making healthy decisions before, then things generally won't change.
Are genetics destiny?
Oh, I'll have to defer to the doctor on that one a little bit. But, you know, I mean, I think
in other words, are some people just genetically predisposed to be overweight or obese, and there's not much anybody can do about it?
You know, I mean, I grew up, I think, as the poster child for Fat Kids of America. I mean, I was an overweight child, but it was something that was stressed in us, and through exercise and through health, you know, was able to have a little bit more healthier lifestyle. But, I will defer to the doctor as far as if we're genetically disposed. I don't know if the research is
So what do you
done.
think?
Genetics have a strong impact in people's weight. It's not the only thing, and people can work hard and lose weight and maintain weight without it, but genetics are absolutely important. Now, when you look at the whole population, okay, you have about a third of the population that is clinically obese, you have another third of the population that is overweight, and then you have another third of the population that is either normal weight or underweight. Now, some of the people in the normal weight population are like Justin, and they go to the gym constantly, and they work out really hard, and they eat really healthy, and that's wonderful. But most of the people in the normal weight group are actually eating the same things and exercising just as little as the people in the overweight
That's
group.
really unfair.
It is. The main difference is they're lucky they have good genetics.
Let me ask you, Justin. You know, one of the ways to discourage people from doing things we don't want them to do is to make it more expensive for them. So, or maybe make it cheaper for them to behave the right way. One way you could do that is through health insurance. I mean, shouldn't we, for example, have higher health insurance premiums for people who are overweight and maybe cut the health insurance premiums for people who are underweight? Couldn't government mandate that?
It could. But
well,
the
actually,
research,
I think that's illegal in many states.
Well,
but do you think they should?
It depends on how you look at it, and frankly, a lot of insurance companies are already doing it because they do it as a positive step. You know, I think most researchers would agree that sort of goading, the stick approach to weight loss, the penalizing people who are overweight is not a good way to lose weight. It creates a defeatist attitude, and it creates a situation where they just sort of give up. And they say, and it also says you can just pay the price to not have to be healthy. So what health insurance companies do instead is they create wellness programs. They create subsidies for going to the gym, like mine, and they create situations where they can subsidize people who are leading healthy lives without penalizing anyone who's not leading a healthy life. And I think that's the proper role. You know, on genetics, I think the difficulty is, right, we have to play the hand we're dealt. But I think the discussion of obesity as a genetic issue, it creates a frustrating degree of defeatism. And it creates this notion that I just can't overcome it. It's the same problem with labeling a disease or saying food is addictive. These are all attempts by people to give reasons why they can't lose weight, and then they won't.
But I actually believe that we do need to classify obesity as a disease, because it is one of those areas right now the doctors aren't diagnosing it. They're diagnosing it for type 2 diabetes. They're diagnosing for hypertension. But until we get at the absolute root cause, which is obesity, we can't put them in a prevention. We can't put them in a treatment situation. So doctors right now are ignoring it. They're doing it for the outlining, but they need to address the core. And health insurances should step up, and doctors should be able to diagnose it, get the reimbursement there for it, put them into a treatment plan, put them into a prevention area, and be able to get it. So we do need to classify.
And the health reform bill does include, I think, a requirement that counseling be provided.
Counseling, but we still need,
be reimbursed.
But we still need to have it.
What about bariatric surgery? Should $30,000 removals of stomachs be required to be a payment that an insurance company makes?
I think after doctor supervision and doctor consultation, if that is what the procedure is that they have diagnosed for you and one that you need to occur, then yes, they should be able to have that treated or have that coverage there for the health insurance. So yes.
What about that, Justin? What about just getting a little bit of help from government, either informationally or with some other kinds of programs?
And you'll hear no argument from me against the government giving information or the government acting in places where it has a nexus between people's, the transportation or the schools, so on and so forth. Frankly, there's not any policy that could be passed that would affect, I think, that very fundamental decision that's being made, short of calorie rationing, North Korea-style food shortages, because that is the ultimate extreme.
I don't think anybody's advocating
no one is advocating that, but all of these policies that are in the middle, the wash.
You're saying, and I think this is a good way to conclude, this is a very difficult problem, both for public policy and for individuals dealing with it. But clearly it is a problem that Michelle Obama is now addressing, and it seems to be on everyone's radar screen right now. So thank you all. Thank you, Justin. Thank you, Scott. And thank you, Penny. And that's it for this edition of Ideas in Action. Join the conversation online at ideasinactiontv.com, where you can see past episodes, voice your own ideas, and dive deeper into the issues with commentary and background information. Or take the discussion with you by subscribing to free podcasts of the program on iTunes. Thanks for joining us for Ideas in Action. I'm Jim Glassman.
For more information, visit us at ideasinactiontv.com. Funding for Ideas in Action is provided by Investors Business Daily. Every stock market cycle is led by America's never-ending stream of innovative new companies and inventions. Investors Business Daily helps investors find these new leaders as they emerge. More information is available at investors.com. This program is a production of Grace Creek Media and the George W. Bush Institute, which are solely responsible for its content.